The digital health solutions are important to us at this lab because it helps us complement our lab services. We also gain efficiency and can do some custom software builds, which is important for us as a reference lab. At Mercy Southeast, we have 8 lab locations, 2 hospital labs, a cancer center lab, a reference lab, and point-of-care collection centers. We were able to install IMS before we even went live on our equipment. We were under construction for a while so that we could keep forward progress on our timeline. The other 2 solutions, AMS and Indexor, we've been live on those for just over a year. One of the biggest improvements that we saw was using IMS. A lot of our labs had too much product, some had too little. We were having overnight orders and expirations and things like that. So using IMS, we were able to right size our inventory for the labs. We can see lot numbers, all of that. In the first year using IMS, we saw an inventory savings of over $700,000. Our processes prior to IMS were all manual. We had spreadsheets printed out on paper, and I had 8 labs, several people walking around once a week doing things on paper. It took an average of 8 to 10 hours a week to get our supply orders done. And after IMS, it takes them about 15 minutes per person. We can run the par levels, see what needs to be ordered. It will let us know a suggested order, and we just check it, check lot numbers, things like that, making sure we might need to adjust volumes up or down. Like when you look at that over a year's time, we were able to save about $98,000 in labor just doing inventory and supply orders. Another problem that we were working with is around auto-validation. Some of the lab sites had that programming in software, others didn't. So those labs usually were smaller, but you have less staff to work. So we were able to have standard rules for auto-validation and for QC monitoring and make sure that that's applied across the system. It's more standardized. And another reason why we like AMS is because it is the software that powers the GLP automation line. So we're able to work in that middleware, and we don't have to switch between LIS and middleware. It's all in one spot. Indexor is a solution that I think in the future our lab can market. As a reference lab, that's a tool that's not really offered widespread, so we can market that and use that to attract customers, but also to ensure that we have quality throughout the sample tracking process. Looking forward, I think there's a lot of things that can be gained from software digital health solutions. The lab has so much data and information that comes through us, so being able to use the software to make decisions or to run predictive trending of a patient, those types of things can be used to improve clinical outcomes. It's pretty satisfying to look back a couple years ago when we were sitting around the table with Abbott planning a reference lab and planning the construction. And it's a well-designed lab. The workflows are really good. The employees are happier, and we also have planned for future growth. We can change things as we need to fit our lab, and all of that work was done in collaboration.